Welcome back to the Wise Divine Women podcast, where we help you go from fed up to faith fueled, helping you to become the wise divine women that you've been called to be. Today, I have Allison from Heal with Allison, and she is a perimenopause specialist and somatic specialist as well. And I just love how she encompasses the entire experience of this journey that we're in all together. And I have invited her on to talk about what her offerings are and how she approaches perimenopause and this journey of wisdom. Welcome to the show, Allison.
Oh my gosh, thanks so much for having me, Dana.
Thank
It's a
you.
pleasure to
Thank you.
be
So,
here.
what got you on this journey? Like, I love the whole aspect of what looking on your website while we were waiting to connect. And I love the whole perspective of the mind, body, spirit and the approach through addressing that, but also with somatic. But how did this all start for you?
Yeah, I graduated from Humboldt State University in California, Northern California, and it was one of the few holistic nursing programs in the country. And holistic health being mind, body, spirit, and so much of that, the mind and spirit piece that gets bypassed in modern medicine, right? So I had 25 years of experience in healthcare systems and clinical healthcare. It's a system that's not satisfying for the provider or the patient, right? Seeing 25 patients a day for 15-minute appointments just doesn't lend itself well to getting into in-depth relationship with your patient and being able to address these other components of the triad of holistic health. So for me, it was lacking, and it was a struggle to operate in that system of volume driven healthcare and trying to provide it numbers based and meet these metrics that these large systems were demanding. So when I got out of mainstream medicine and opened my private practice, then I was really able to dive into the magic and the mystery of health and these other pieces of the triangle that create our health as a dynamic relationship between mind, body, and spirit. It's not just
Mhm.
about the physical body. We have to treat on the energetic level. We have to treat on the emotional level. We have to treat on the spiritual level. All of this is what helps the system feel supported and thrive. So it
Right.
was really clear to me I wanted to build a practice where I was able to get deeper with patients and talk about everything from relationships to work life to faith and spirituality and bring that into an energetic treatment, bringing the somatic piece, bringing the emotions and the energy through the body, finding expression and movement to release that energy so we don't have emotions that are being turned inward, like anger and grief and shame and guilt that end up showing up in disease patterns later. So it's all health driven and it's all about supporting patients in their highest form of health. And I'm thrilled that this work has brought me into perimenopause. It's a party wave. There's so many of us that are in this phase of life, and every person with ovaries is going to experience perimenopause. So we all know it's a foregone conclusion that we're gonna be in this phase of life. And my goal is really to help people feel empowered, find a deeper connection with their body, to celebrate this transition into the wise woman era, really see this as a rite of passage.
Yeah. It is. It becomes a really difficult time. It is like a roller coaster. And we're all still in this mindset of we're still 20 and we're still carrying on and we live life large and we have fun. And then we get sideswiped with our emotional roller coaster or hormonal waves. And then we're unsure of how to approach things. And it's the accumulation of the sum. Like it's our lifetime that brings us to how perimenopause responds within us. Everyone's a little unique. Everyone comes into it differently and everyone has different symptomology. So where do you find the disconnect of the triad beginning? And how do you approach that
Mm.
healing process?
Yeah, I think you raise a good point. You know, it's an evolution. I think that there's societal roots in not being very well modeled how to express our emotions, how we're told to sit down and be quiet and be still and not use the body in order to discharge extra energy. Kids don't want to sit down. They want to run around. When they get upset, they want to move, and we're forced to sit still. We're groomed to turn everything inward. So in midlife, we get to this point where we just can't do it anymore. We kind of throw our hands up and say, wait a minute, this isn't true for me. This isn't making me feel like my authentic self. And it's always this feeling of like, if you're at the gym and you only have 20 minutes instead of half an hour, like you're going to work out harder. It's like when you have that sense of like, I'm approaching what the last one third of my lifetime or something, it's like the pressure's on. It's like now or never. It's like figure out who you are, how you want to be, how you want to show up, how authentic you can be, how clear you can be. And the body is giving you this like alarm system that's saying it's now. Now's the time. You're going to go through this squeeze, this identity squeeze for you to come through the other side. And you have the opportunity to step through and be a leader for those younger than you, for those close to you, to see what real authentic living can be.
Yeah. Yeah. It is a season of being a sage and
Hmm.
learning how to use your voice and your body and your actions to help the younger generations to not go through what, and end up where we are. And it's this allowing us to recognize our voices and have strength and confidence in that. I find a lot of women don't understand their voice and how to share or that identity within themselves. And I love how you approach that as that complete sort of understanding of yourself moving forward in life, right?
Yeah, women in particular are being told to be small and to shrink and to be quiet and the people pleasing and to look pretty and to smile and to take it and to stuff it down and to pretend like we're not raging inside. Like there's so much happening in society at large that's so upsetting these days. But I think that there's a lot of potential beauty here that old systems are cracking and breaking down. And so many of us as women are standing up and saying, we are not going to keep doing
The same old.
playing that role that we've been playing. Yeah.
Yeah, I love that. And you must find that with the people that you work with, the women that you work with, in the sense of like that's it. I've had enough. I'm standing my ground, moving forward. Like it's just such a thing. I mean, you were in the medical field for so long, and it is a broken system that just doesn't serve the same purpose anymore. And I feel bad for those practitioners who went in with a healing heart, right? With that compassion to heal, to be in a system that they are very confined and boxed. So I'm always reminding my clients that they are doing the best that they can. They're doing such a great job with what they're allowed to work with that, use them to the best that they can be. And you have to become your self advocate. That is the most important part. I think with the medical system now is that self advocacy and not looking to them to bring the answer. Whereas intuitively within ourselves, if we pause long enough and meditate and listen to what our body's trying to tell us, I think once we release those traumas and emotions and those things that we've built up inside, we can actually intuitively hear what our body needs. Do you find that with your clients?
Definitely. I think that's really so golden what you're saying. You can't get all this education that you need in a 15-minute appointment. These appointments need to be organized and you need to have your list of objectives. If you want to start hormones, you need to go in there advocating to start hormones and what kinds of hormones you want to start. And this can't be the appointment where you are just hearing about hormones for the first time. It's like we're in this phase where I think before healthcare appointments were a lot more about education and counseling. And now there's just not the time for that. And people have to learn on their own what it is to ask for, what it is to ask about and request.
Mhm.
Um, and also know what their options are going in. When you see a traditional healthcare provider, you're going to be given a menu of choices that align with their system, right? You go to acupuncturist, you're going to be given herbs and needles. You go to Western medicine, you're going to be given prescriptions and labs. It's like it definitely depends on who you choose as a provider, what kind of
Mhm.
care you're going to get.
Right.
Turning inward and trusting yourself, this discernment that we get when we are dialed into our intuition and someone's offering us hormones, and intuitively we say that I don't want to start hormones yet, or maybe I want to start on a lower dose, or maybe I want to get my testosterone levels checked first and advocate for starting testosterone. Whatever this is, it's like when you're tuned into your intuition, you have that sense of authentic truth that lands in the body when you're listening to somebody and you're like, that lands for me or that doesn't land for me. And I need to get more information. I'm not ready to make a decision right now. Then that is one of the most helpful aspects of a good relationship with your intuition is just knowing what you're getting, what you're receiving, if it's for you, if it's not for you.
Right. All right. And that's so true. I mean, and this preparation of understanding yourself, building your discernment, understanding the process or well, it's a natural progression actually of perimenopause. You can't get around it, but it's this sense of this better understanding. Now, is that what you're teaching in your perimenopause program?
Yeah, we have 13 modules and we cover everything from hormonal options to herbalism to somatic practices to help support all the emotionality that comes with the hormonal imbalance, that rage that comes through at this time in life that's so common, right? Yeah, finding ways to express that and move that in a way that doesn't blow up your whole life. How many patients I have come in that say, I can't stand listening to my husband's breathing anymore. I have rage when he's breathing. What do I do with that? He's great. We have a great marriage. We have a great family. It's not like I need to blow up my life, but what is this rage telling me? And somatically getting into the body, it's like, right, what stories are attached to that? One, maybe I don't get enough space for myself. 2, maybe I don't get the time to step away when I need to step away. 3, maybe I was never modeled an appropriate way to discharge anger. 4, maybe I don't know how to move my body that communicates to my body that anger is moving. Like, all of these different things could be different for different people. So a woman that walks in the door with rage can mean any different number of things. And the body is the key. The body's the path to understanding what the story is. This is the mind body connection. A story is what keeps the emotions looping, creates that rumination. It like keeps it alive in the body. Versus when we get into being able to move and discharge that energy, we can interrupt those old patterns and stop the looping and
Mhm.
find a way to regulate ourselves and maintain healthy relationships. Most importantly, like foster that loving relationship with ourselves.
Right. And that is the most important thing is that relationship with ourselves. Right? It's funny that we're talking about this because that was the conversation I had this morning with a client was she was relooping her story over and over and over and over. And I was just like, okay, stop. You can't do that anymore. Right. It's just not serving purpose. And she was heading off to another appointment after. And I'm like, you with the spirit of opportunity,
Mm,
don't repeat the story. Like,
that's
you have to change it, and we were talking, I said, "Well, you've heard of," and I never say it correctly, the Ho'oponopono, but it's like you have to reframe things, you have to retell the body and mind a new story. And I find that with people that because no one has ever listened and no one has ever solved their issues, they're always repeating the same story or same issue as a practitioner, and you know that you're not the only one that they've been to, that this is maybe the 10th person that they've told their story, then that doesn't serve the purpose, right? So you must spend a great deal of time helping them rewrite their story.
Mhm. Mhm.
Yes. And then you're giving them the practical tools, I suppose, to help them the nervous or help them to understand how to rewrite it and how to reprogram the body through somatic exercises.
Yeah, the holistic model, those 3 pillars. So the body, we're talking about hormonal balance and labs and everything that we can do, herbalism to help really create a support for those symptoms in perimenopause. Then we're in the mind pillar, and this is where we are with the emotionality and the storytelling and these core negative beliefs, these unmet needs, these wounds, childhood wounds. So getting into all of that is definitely about finding vulnerability and truth and really finding hope and self-compassion through that process. And then the energetic, the spiritual side of it is really about how to how to cultivate more meaning out of your personal experience, right? We're not just here to suffer, to be born to, and to suffer and to die. We're here really to make the most of something, to tap into our highest potential, to help walk each other home, like Ram Dass said. It's about, right, being a beacon of light, like being a channel of inspiration. So, can you, in your own spiritual lens, whatever your spirituality is, find deeper meaning and cultivate a deeper connection with your mystical divine being? And those are the 3 pillars about how I approach health. Yes. So it depends. Somebody might come in and need more help in any one of these areas.
Right. And those are foundational. You can't skip a beat. These are key areas that need to be addressed and supported, I guess, before they really can see a great transformation. Right.
It's a 3-month program, the Perimenopause Portal, and people renew. So there's a community aspect to this with weekly calls, and people just continue to renew because of the community itself. There's such beauty in women coming together and supporting one another, and that journey of growth and transformation isn't linear and isn't just A, B, and C. And it's almost like your graduation from the program is when you decide to step out on your own, take what you've learned and get out into the world. Of course, I'm always available. People come back and see me one on one sometimes and start a series of appointments one on one also. So that it's that inner work that's never really done. It's a journey, it's a health journey. But a lot of people come in really in crisis, feeling really unstable in perimenopause with all the symptomology. And the journey is to give you strategy and tools to manage your experience and to find deeper meaning and to find more stability. Ideally, by the end of the 3 months, you are ready to move on. You have everything you need to make a sense of it and to be able to have your feet under you again, to find relief, to not be so overwhelmed, to have real information about how to proceed at your appointments and managing like what kinds of labs you want to have drawn. I recommend my patients get labs every 3 months until we get hormonal levels stable. So there's a lot of strategy involved with just like, oh, okay, these are some real tools I can take into my healthcare provider appointments. I have prescriptive authority in California and Colorado, so I can prescribe for patients in California and Colorado, but a lot of the program is just coaching and not healthcare delivery. It's about tools that you can take to your healthcare appointment.
And you're teaching them how to utilize the tools that you may be advising them to ask for, right?
Yeah.
I think
Yeah.
that's one of the
Yeah.
most
And the
important things.
beautiful,
Go ahead.
I was just saying, I'm not sure where, if this is true for where you are, but here in California, you can go get your labs drawn now without an order.
Yeah.
Like you don't need a doctor's order to get your labs drawn, but you
I'm
need to know
seeing
what
that in
kind of
quite
labs
a
you want.
few. Yeah, I'm seeing that in quite a few different states. In Canada, we're not quite here yet, but it's getting there. So it's again, but what do you do with the information? That's the brilliant opportunity that I think that people have once they understand the different blood work or the different salivas, different, urines, different, all the different things you can do. And then what do you do with it? And so it's finding, like with yourself, you're teaching them the tools of understanding. And I think that different practitioners now want this. You need the test. You need to understand where you're at. And I love that you, one, can prescribe, but two, that you must teach them about their labs and how that works. I think it's amazing. I
Mhm.
think we're seeing great advancements, right?
How's the connection on your end?
It's so, I can hear you fine.
Good. Yeah. Yeah, labs are so interesting because we used to tell people that we just didn't draw labs. There was this attitude like, you don't need to know what your labs are. Or this sort of patriarchal approach in medicine where like the provider has the information and it makes sense to me and I have to be the one that interprets it for you versus some really simple approaches to your testosterone level that we want to see above 17. Like, it's as simple as that. If you're under 17, supplementation. If you're over 17, you're in the low end of normal, but you're okay, right? Estradiol, when you are on estrogen therapy, should be above 35. We wanna see it above 35. So if you're on estrogen, you should get tested so that you know you're in the therapeutic window. A lot of and this is kind of unfortunately what I'm seeing is there isn't a lot of follow-up with the labs where people are getting their prescriptions and then they're saying bye bye, see you next year. And there's not this follow-up that's like in 3 months from now, we should make sure that that's the right dose, that that's enough estrogen for you and titrate you, bump you up. There's no other hormone like insulin, like thyroid hormone that we just like write a prescription once and then say, see you next year. We follow the labs until we know you're stable at the right dose.
Yeah. I see thyroid, people on thyroid that have been on thyroid forever, but they don't know. I asked, well, do they follow up? I don't know. This is a tricky thing. Like your thyroid is very sensitive and they don't have follow-ups with the thyroid, which I think is crucial. And it's
If you're
always,
on the right dose,
yeah.
if you've been really stable and you're on the right dose, you can be on the right dose for years and you could just go in for every 6 month or annual test. But thyroid's really interesting because there's so many different thyroid tests and they all indicate different aspects of thyroid dysfunction. So it isn't just one single test that tells you about your thyroid. The TSH, the thyroid stimulating hormone. You want the T3 and the T4. You want to look at the whole picture.
Mm-hmm. I love that. I think it's fabulous. And you talk about these things in your perimenopause portal program, correct?
Yeah, yeah, we don't spend so much time on thyroid, but that's the beauty of having it like the live calls, the weekly calls, because anybody can ask any question during the weekly calls.
I think that's amazing. That's amazing. So what does somatic practice look like? To me, it's a word I use
Mm.
often. Most people have no idea, but what does or what encompasses somatic therapy?
So the somatic just means body. It's a Greek word that means body. And we know that we are experiencing physical events when we have an emotional experience. We cry, we have increased heart rate, we feel nauseous, our palms sweat, we might have throat closing, we might have redness in the face or the chest. Oftentimes, so many of these things are happening at once that we're so uncomfortable, we likely suppress the emotional experience just because there's so much happening and we feel flooded and overwhelmed and it's like, not right now. No, I'm not going to get into it. Versus when we are in a safe, supportive space and we can really explore what's happening. Somebody might be talking to me and I can hear that their throat's closing. And I can just say, can we bring some attention to the throat? What's going on there? What does that really feel like? Can we track this physical sensation that's indicating that there's an emotional experience happening? Because this will actually happen before we understand what the emotion is. The body knows first. So with observation and reflection, I can see, like, say your throat's closing. What is that? And we start questioning, what is the feeling that's wanting to come through? And can we increase the tolerance for the emotional experience? Can we find more capacity to feel and to stay present with our feelings by tracking the physical sensations? So that when these uncomfortable emotions come up, we're able to stay present and stay in the interaction as appropriate, but that we don't dissociate, that we don't get the hijacked by the limbic system. We don't go offline and end up totally flooded and overwhelmed and dysregulated, right? Can we find a way to stay present with the physical sensations so that we, yeah, foster a deep presence with ourselves? It so often comes back to the inner child work, and that there's a scared part inside that is afraid of rejection or abandonment and doesn't want to speak the truth, doesn't want to say what's really on their mind. And this feeling like the throat's closing up is this feeling like I need to swallow my truth. I need to shut it down. I can't be myself. And it's usually a very young part of us that is afraid of
Mhm.
abandonment or rejection. And so there's a lot of fostering like that, like meeting the self abandonment wound. And when we go there, the beauty of self compassion that comes in when we realize, like, how much we deserve to speak our truth, how much we deserve to honor our experience. Like, we're in this physical body for this short period of time. It's 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 not for us to say no to our physical experience. It's really, can we be curious about what's happening? And oftentimes you'll feel like this is the door to understanding your body is talking to you all the time. And this is the key to understanding your intuition, which often a lot of people feel in their gut. But if you're used to saying no to every physical sensation that's uncomfortable because of emotional overwhelm, then your intuition gets buried in there too. And so, what we're wanting to do is create more capacity, create more tolerance, create more acceptance, and more love and compassion for all of ourselves to come online and be present and be able to communicate internally what's happening in real time.
That's amazing. That's so good. I know that it always sounds like when you're talking inner child and you're talking those types of things, it always, to me, because I've not done the work, seems a little overwhelming. But I love how your approach makes it seem so much simpler. It is hard work, but it seems to come across much with great ease, right? In the sense that there's light at the end of the tunnel of this, and it is a difficult time to bring all those things up. So I love that.
It's like baby steps, right? It doesn't just happen in one session. It's like, how can we gently create more capacity and more safety around feeling our feelings? So
Mhm.
many of us were told our feelings weren't appropriate, or our feelings were too big, or we were too sensitive, or we were not allowed to have feelings. You can't stop it, right? The feelings are there. And that's where we start seeing these really complicated disease patterns, right? Internalized anger often shows up as cancer, right? We see gut issues, ulcers, we see all kinds of real physical illness, and we look back to these roots of just exploring the topic. What's the emotional landscape like here? And it's not that
Mhm.
there's one answer. I'm somebody that has a foot in both worlds, love Western medicine, and I love the modern treatments that we have available. And I also think that health challenges give us this window of opportunity to find deeper meaning and deeper inner wisdom.
Mhm. I really believe that the modern therapies or the modern approaches to a lot of the critical diseases like cancer, things like that, can only work better if the emotions are addressed. If you're helping the mind as well. I think that's imperative. And a lot of the bigger cancer centers, of course, approach things like that, making sure that there's that There's understanding the emotions that sit in the body, those types of things. But in a normal setting, it's not. It's just therapy and off you go, hoping for the best. But they haven't prepared their mind for the incident or the therapies. They haven't prepared their body for the therapies either. And I think we approach perimenopause in the same approach. Well, okay, we're just going through life and here we go. That understanding of how the mind is going to manifest in the body and or how the energies of life manifest in the body is also going to affect your menopausal journey, right? So I love how you approach the bigger picture to help their natural transition flourish.
Yeah, and you had just touched on this earlier, the wise woman era, really graduating into, yeah, our mature selves, like really being leaders in our communities. Like this is the time that we can't pretend anymore that we don't know, because we have this lifetime of experience behind us. And it's time to put this into a schematic that serves you, to say, I do have lived experience that gives you a unique confidence that nobody else can claim. This is uniquely yours, this life that you've lived to this point. And because it's uniquely yours, there's no reason to not claim it. It's only yours. And this is your opportunity to wake up and take this gift that this era of your life has to offer, to step into your power and to step into being able to really thrive and shine and show others the way. Really, younger women need to be able to see us thriving in perimenopause and menopause. They need to
Yeah.
know that there's hope. They're wise to the game of being groomed. All of
Hmm.
everything that's being blown up in society these days. I
Hmm.
have hope for young women that they aren't so easily subjected to being groomed as prior
Right.
generations have been.
I think it's so important. So I'm going to put my this up here. I think it's so important. It's going to be our voices that make the change or the advice that we can give to women so that they're not repeating the same patterns. And even in sort of that spirit realm of things, we can have the opportunity to break generational curses. So it's this movement in this aspect to make those changes for the generations to come and teaching our own daughters or even our own sons to these were bad habits and these are not a healthy environment that they can make the change again for their next generation as well. So it's very moving in the sense of the simple words that we have can make changes for generations to come. And it's for us gaining our confidence. And through the insight, even with your perimenopause portal, the insight that you give to the women are only going to empower them to have that authority to make changes moving generational, right?
That's where the hope is, right? Yeah.
So, in a nutshell, perimenopause portal, break it down for me. And is it always going? And anyone can jump in anytime.
Yeah, it's 13 modules. There's self-led modules, there's videos and PDF handouts, the weekly question and answer. There's also access to the Somatic Magic membership calls while you're in the perimenopause portal. And those calls are somatic-based coaching to increase, right, the awareness of your spiritual gifts. So, Somatic Magic is another one of my programs that's just always going on in the background. We have a great community of seekers in that membership. So, the question answer is really that most valuable time when we have the community. There's a lot of relationships that can come from being in the community together. That's my hope, is that women meet and maintain relationships beyond the program itself. Then there's one-on-one appointments where we can get into more specifics of what you're really looking for, what you want as far as targeted health support. And if you want to make follow-up appointments, you can contract those individually. There's a lot there. And it came out of really feeling like there's a lot of stigma around aging, and there's a lot of complaining. Like there's like this compulsion to complain about our symptoms, and misery loves company. So it's like you'll get a bunch of 50-year-old women together, and it can devolve into complaining. And I was like, I want to create a new model here. I want to shift this paradigm, and I want to rebrand this experience as an empowering experience. That's something really beautiful. That's a rite of passage. So that's how it came to be, specifically feeling like there was a real need for some positive branding of
Mhm.
perimenopause and wanting to bring this into the world.
Right. I love that. I love that approach. I love that refocus because it can be terrible out there when you get everyone together. And exactly, you don't need this buildup of anxiety and rage to spill over into the community as well. So I love that. And I think community is so important. It's so vitally important. That's why I did this out of the necessity of COVID and just being able to speak and share and talk to people around the world. And it's just incredible. So all of that information, of course, will be in the show notes. And I want you to find Heal with Allison and Perimenopause Portal and all of somatic information because I think it's so vital for women in this journey to make really positive changes for the latter half of their life. We want to finish well. We actually want to finish better, I think. Right?
Yes.
Yeah.
Yeah.
So I always end with what is a word of wisdom that you always hold true to or that you find that you share often?
The sovereignty has been coming up a lot for me. Yeah, energetic sovereignty, and yeah, this concept of sovereignty that is entirely dependent on you knowing yourself. Without knowing yourself, you don't have sovereignty. So when I know what I feel and how feelings come up and show up in my body, then I'm able to track my experience, and I know when I'm in alignment or when I'm out of alignment. And sovereignty, it really only comes from being willing to explore the corners of my own mind to really find, yeah, that those pathways in the body of expression so that I know myself so well that when I walk into a room, that I am not dominated by the loudest voice, that I don't just shrink away when something's uncomfortable, that I'm not afraid to stand up for others when I'm called to. Sovereignty is so essential in so many ways, and it's really at the heart of being able to hear my intuition and act on my intuition.
I
Yeah.
love that. That's so good. Sovereignty and that is just puts it all together just wonderfully. Thank you so much, Allison, for being
Thanks for
so
having.
patient connecting today, sharing your heart and soul and your passion to help women all over the United States and probably the world because your draw would be energetic and those people who need you find you. And I think that's just incredible. Thank you so much for sharing your heart today.
What a pleasure to be here. I really appreciate you having me.
Thank you
Thank
so much. All the information for Allison will be in the show notes. So please get in there, connect, reach out. Wonderful information. And thank you. And thank you for being part of the Wise Divine Women podcast, where we help you go from fed up to faith fueled, helping you to become the wise divine women that you've been called to be. Thanks for joining.